It's those little things that keep me finding my way back to the Orange County line.
Hello and welcome to the Y with Dr. T. I'm here with another one of my favorite people, Dr. Dave Beachy. Dr. Beachy and I, we go back many years,
That's for sure.
and I am so happy that you're here with me. We're going to talk about all things community, but a little bit about what your medical profession looks like in rural communities, and then how we may have intertwined in that profession. So, thank you.
You're welcome. It's a pleasure to be here. Thank you for having me. I'm honored.
Well, so I started community mental health in March of 2000. You were already
Uh-huh.
at the hospital, right? So tell me a little bit about your medical career and
Well, we came in '83,
okay.
and initially it was just family practice in Paoli with comprehensive health care. And now, were you in practice at all at that time? At
No,
'83 to 2000?
no, no,
Okay,
no.
okay.
So I started um, at Southern Hills Counseling Center in 2000 as a case manager. So I wasn't even in real clinical care at that point.
I see.
I didn't start ER psychiatric consults until 2002, 3 when I was going back to get my master's degree.
I see.
But you were a part of the original, which is comprehensive healthcare, but is now SICHC. And I had Wally and Evian who were
Yeah.
part of that group.
Yes. Now, I was not part of the original. I came about, I think, 7 or 8 years after Wally and Evie and Dick Graber and Terry Knopfsiger and Luke, came. Um, and it was a real privilege to work with them, for the first 17 years in my medical life. It was such a privilege to work with them. That was probably one of the biggest parts, and then just to have all the relationships in family practice was so rewarding. Then we left in 2000 and went to Africa. We were in Kenya for a year and a half, and then we came back, and I always thought I'd go back to Kenya, and so I just didn't wanna go back into family practice and leave my patients high and dry again like I did the first time, and so I just stayed in the ER, and so I was in the ER then until I retired several years ago. And, the ER, that was about 2001, so that was about the time that we got to know each other.
Mhm.
Um, and boy, Brandy, so many times you helped out so much.
There's a lot of long nights.
A lot of long nights
Long
because
nights.
when we'd get into situations that were over our heads as family docs or as ER docs, we really needed
Yeah.
help. And to help with diagnosis, help with knowledge of whether somebody needed to be um, placed somewhere, and also where to place them, and then to find a place and get them to accept the patient. And that was really a big challenge. And many nights, you were in there for hours and hours. And Southern Hills, you and Dr. Knight, and there were others
Mhm.
who were in there for hours and hours at a time, sometimes 4 or 5 hours just
Oh, yeah.
with one patient. And that was I couldn't believe at the time that that was happening. I mean, I thought this isn't really sustainable, but I loved it, and I appreciated it so much. But that was a big help. It was a long answer for a short question there.
Well, and with that, so we were back in the day, in that time, we were also expected to be at work the next day. Now, I do know that there was some leeway on hours, so
Uh-huh.
if we were supposed to start at 8, maybe we didn't get in there until 10, but the reality was you still went to work the next day, even if you spent almost the entire night in the emergency room, which often happened because there were so many times where we would get one crisis handled and then another
Another one
walk
come
through
in.
the door.
Yeah.
There is one thing that I can say about, so this was before it was IU Health Paoli. The name was
Orange County Hospital.
Orange County Hospital.
And then Bloomington Hospital of Orange County.
Yes.
And then IU Health Paoli.
Yes.
That's where we
So there's been several reiterations, but one thing that I think always kind of stood out for me is when the hospital did the renovation, and it was before IU Health, so it before the name of IU Health. The emergency room went through a renovation, and at that time, to remember where they had the specific rooms for mental health crises.
Yes.
You really didn't see a lot, and these rooms were special and were meant to help alleviate some of the issues with mental health crises that you may not necessarily see in that standard medical room.
Yeah.
And I always thought that was above and beyond, I thought, because
Yeah.
it showed compassion in a time when people really need it.
Yeah.
And I think
Yeah.
that was good. I think that we had a really good relationship with the emergency room when handling psychiatric emergencies.
Yeah, I think so too. And it's such a real issue. And I'm grateful. I'm especially grateful to Gene Perry. He was the administrator who did the renovation and who really brought that to pass. And he saw people as being a whole person, and he wanted to make sure that we had capacity for that. And I've appreciated now IU more recently than IU Health was able to start assisting with placing people and so on. I personally like the personal touch of having when you all would come over and just be there and we could talk about it and the patients would be right there with you. But I can see why it's necessary to have a different system because of the nature of mental health care today.
Yeah. One of the things that I always remember is blood work, drug screen,
Yeah.
medical history, medications.
Yeah.
Yeah, and it's
Yeah.
okay. What are those things?
Yeah.
And then we figure out the rest after that.
Yeah.
And I feel like we had a pretty smooth system, although it didn't run quickly. I think that
That's right.
we had it down pat, but there's a lot of moving parts with psychiatric consultations, especially in the middle of the night.
Yeah. Yeah, when there's substance, especially when there's substance involved, because it would take you can't do all those things in parallel. It had to be done in series. So you have to do part A, and then you get to do part B, and then part C, and then part D. And then eventually, you get involved, and then you have to go through this whole series
Yeah.
of issues also, of steps.
Yeah.
So, the people, I think that we helped a lot of people. I think there are times that I'm sure that there are times when we erred, and I don't know of times that we've erred, but I'm sure that there are times that we've erred, and it's really a challenge to take on the complex issues that have to be taken on, and that have been taken on over the years here at the hospital. We're so blessed to have this hospital in this community. I think that many people, if you live here all the time, it's easy to forget that there's a lot of communities like ours that does not have a hospital, and they travel for 20 minutes or half hour, whatever, to get to a hospital. And so I think we're really fortunate, and also fortunate to have the mental health facility associated with that.
Yeah, and I think that we know that communities who don't have hospitals in the center of them, we can see the data. We can see that issues are higher. There is, the longer you have to travel to a hospital, the more that your health issue becomes a crisis in a lot of regard. So time matters
Yeah.
when we are seeking, especially emergency care, issues that relate to emergency care. The further you are away from an emergency room, the worse your outcomes could potentially be.
Yeah.
And we see that.
Yeah.
So,
Mhm.
yes, Orange County is very fortunate to have a hospital at their back door. And I think it is easy to forget that.
I think we're also really blessed to have a lot of the staff that we've had at the hospital over the years. You know, these have been like family to me.
Yeah.
And in particular, in the early years when it was just people that were mostly local people that were working there, and we were all like a family, and we knew that if it didn't get done, it was gonna if we didn't do it, it wasn't gonna get done. And so there was a lot of really close relationships there. And I know there was recently several years back, a study from Harvard talking about growing older and elderly people and people over 55. I'm certainly in that category, that the value, the quality of their life depends on relationships. And if you can have, a $20 million house, but if you don't have good relationships, you're just not happy. And it's not just relationships with one another, but relationships with God, the spiritual relationships, and with family, with friends. And, at the ER, it was a wonderful place, a family practice, a wonderful place for relationships. And so I feel like I was tremendously blessed to be able to be in practice, both in family practice and then in the emergency room here. I'm sure I gained way more from it than my patients ever did.
Yeah, and I would definitely agree that even for me, those relationships, they helped to grow me into the profession, and they really helped to be a backbone for what I know now, and to help me see so many different situations. And in my case, I was able to blend that medical and mental health and substance kind of all together, that experience, and be able to, to see a whole person, and not just a whole person, but a family, because that is one of the things in rural communities, and these types of issues affect families, not just an individual. And that doesn't matter whether you're rural or you're where you live. I mean, that's just the thing. But I do feel like there's something special when we can walk into an emergency room or a primary care clinic and see the same physician, that's been there for a while, or the same physician that maybe delivered our kids or delivered our grandkids, or whatever it is. I think that there's a lot of value in that relationship,
Yeah.
and I think it helps health outcomes.
Oh,
I mean, I
absolutely.
know it does.
Yeah.
I mean, because research says it does, but the relationships that we have can very much be a positive or a negative depending on what those relationships are.
Yeah. Mhm.
So
Yeah.
it's so um, important to have healthcare in these rural communities. Well, it's important to have healthcare everywhere, but to be able to have steady, stable providers is really a blessing.
It sure is. Yeah. Yep. We are looking at moving now. We're planning to move out of the community because we want to be with our daughters in Michigan and in Dallas, and with our grandkids, daughters and their families. And so I feel a great loss in leaving the relationships here, both at the hospital and our church and other relationships that we've had. So, but I'm thankful that there's relationships that we can continue with at other places. So, it's been a real blessing to me to be able to spend my whole medical career in Paoli. That was really a blessing for me.
That's truly amazing, and is such a value to Orange County. I know that when I had Wally and Evie on here,
Yeah.
they also talked about being able to spend their medical profession right here, raise their kids here, raise children here, and raise communities here, really. And we talked about the first real kind of interaction that I had with them was strawberries. And if you don't remember, I would load up a truck bed of strawberries to take to the emergency room. And during strawberry season time, because we had so many. And yeah, and I was there all the time. So, that's where all the extra, produce went, and the extra cake and food, we just take it to the emergency room. But what great stories is that?
Yeah,
That's a really good place to
yeah, yeah, yeah. A real sense of camaraderie and family in the ER, and a certain security in knowing that people are competent in what they're doing. And that was really wonderful, especially with the nursing staff uh, and the EMS and the mental health programs. Yeah.
Yeah. That was something else. So, outside of the emergency room, what have you been up to?
Well, we've been traveling a lot. We actually have recently bought a house in Holland, Michigan, and we'll be moving up there sometime. We don't know when. Um, so we've been traveling there and to Dallas. I've been able to play some ping pong on occasion with a number of guys, including Jim O'Connell, who you had on.
Oh, yes, I did. I had
Yeah,
Mr. O'Connell on, yeah.
yeah, he's such a good player, and others. It's been a lot of fun. We usually laugh about as hard as we play ping pong. Um, and we have a big garden, so we've worked in the garden quite a bit. We have a small acreage, and I've spent a fair amount of time and energy working and doing real band work on the acreage. And then I'm involved at our church some too. So, and then we have a lot of guests. We enjoy having guests mostly from out of town, and we do have a lot of guests that come.
Yeah.
Visit
And
us.
one of the things that I remember about, PMF is it seems like everybody always had a house guest. It seems like there was movement somewhere, and I just
Yeah.
always thought was great. There was somebody from somewhere staying for a while or going somewhere, and just so many adventures and so many stories and so many lessons you can learn, just to know that there's a bigger world out there.
Yeah, 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 and yeah, at PMF in particular, I bet half the people there have been overseas or stayed overseas for some time in the past. Yeah, another thing that I didn't mention there when you ask about where I spent my time is I have a mentee from the community, and that's been a very rewarding process for me. We try to get together every week at least, and we have a lot of fun together. So I've really enjoyed that.
Do you know the history of that, youth mentoring program and how it came to be?
Yes, I do.
That's another amazing story about the connection with Southern Indiana Community Healthcare
Yes.
and their drive to address adverse childhood experiences.
Yeah, and that's such a good program. I fully believe in that, and I'm so thankful that, that for Ramona and the work that she did and then those who have carried it on, and it's so wonderful, because, man, I really feel for the kids that get these ACEs piled up, and it's not their fault. They just have to try to live with it, and it's a great program because it could really make a difference in kids' lives.
Well, and what I see is you saw the adverse childhood experiences or ACEs in the emergency room all the
Absolutely,
time.
absolutely.
While children were going through these toxic stress situations, but also how it affected children when they became adults. And
Yeah.
and we can see that. And then now you're on the other side of that with basically prevention.
Yeah.
With when we link up mentors and mentees together, then we are able to intervene and potentially stop the negative effects of adverse childhood experiences.
Right.
So, that to me is kind of a full circle.
It is, and I think it's really a valuable tool because it's like going upstream. Ramona used to
Just
always
like
talk about,
Ramona's
yeah,
upstream.
you go
Yes.
upstream and you stop it
Yeah.
stop it before it gets down to where you're seeing problems with substance abuse and unwanted pregnancies and homicides and all these different problems, that if the kids can be helped early on, a lot of times it can change the whole course of their life. And there's just no question about that based on the scientific evidence.
Yeah.
And so I'm very, very thankful for that program. And I think Orange County is unique. I don't think there's many counties anywhere that have done as well as Orange
Yeah.
County has.
So what you're talking about is trauma-informed care frameworks based on adverse childhood experience research. And there's a significant amount of adverse childhood experience research nationally, but and even globally. But here we have focused on our own research. We know what our adverse childhood experience issue is here because we've done the work. And all the programs that you mentioned, plus many, many more in Orange County, is solidly based on the work of understanding adverse childhood experiences and how ACEs affect Orange Countyans. So, I think you're right, we are unique because we identified a problem, done the work to figure out what is the problem, what's the data, what are we seeing in Orange County specifically, and then we put the frameworks together to keep working on fixing the problem.
That's right.
Because nobody's gonna really fix that for us. Nobody's coming in and saying, "Oh, we have the answer to your question and to all your problems, and we're just gonna take care of you." There's nobody gonna do that.
Yep.
We have to do it ourselves.
Yeah. I hope that someday the government will understand this because they could save so much money, for one thing, by going upstream and help preventing these problems from the beginning. It would save a vast amount of money, and I mean, that's what and plus it would help so many people.
Yeah.
So I'm just grateful for the work that you and others have done here in Orange County with that program.
And you mentioned the government, and you're right on that. So, of course, there's a lot of levels of government, but what I will say is, w what government do we have the most access to now? It's our local government.
Right.
And I can tell you without a doubt, hands down, without a doubt, that our local government has been very receptive of understanding what adverse childhood experiences are and what we need to do about them. And they have, in many ways, utilized funding to make sure that we are addressing that upstream model, that prevention model. So
Awesome.
I don't see that in every county,
Huh? Yeah.
but and there's still work to do. I'm not saying that
Yeah.
we're all perfect and we have a perfect system. I'm just saying that our local legislative body, elected officials, appear to really be ahead of the game. And that's
That's
also what it takes.
yes.
We can be doing groundwork all the time, but it has to get up into those decision makers' hands
Uh-huh.
at
Yep.
all levels.
Yeah.
And we just need to start where we are, and that's our local government. And I can say
I think that's a good perspective.
that they're
Yeah.
definitely aware and working on some initiatives that address ACEs and healthier. The healthier our community is, the healthier we're all going to be.
Right.
So
Yeah.
we have a lot of agencies that are anchoring this type of trauma-informed care movement. And again, to your point, we're pretty unique.
Yeah.
And most people don't even know.
Yeah. A lot of people are totally unaware.
Idea
Yeah.
that this is going on.
Yeah.
I really don't.
Yeah.
I have
Yeah. I think I had heard that there was about 80 mentor mentee pairs at this point.
Probably. I think my last update was about 70. So
Uh-huh.
probably. I
Yeah.
mean, it's
Yeah.
it grows all the time.
That's awesome, and it's a great experience to be a mentor to
Yeah.
a young child.
So when we were doing the research, when Ramona was in the very beginning, when we were looking at adverse childhood experiences in our 3 high schools, our high schools all allowed us to do the standard ACE screening, and we surveyed 9th through 12th or 7th through 12th graders in all 3 of our Orange County schools. We only missed 200 children, and it was 100 declined and 100 were absent during our
Interesting.
yeah, so the numbers were pretty high
Yeah.
of completion, and what we found was 30% of our 7th through 12th graders were reporting an ACE score of 4 or more. And
That's
research tells us that that's kind of the mark when negative outcomes as an adult can happen. So we already knew we were double the national average. National average is around 15-ish. It's kicked up here in the last couple years a little bit,
Yeah.
but it's roughly 15. In the original study, it was 12.7. In around the mid 90s was the original study. So the point in that is whatever is going on. I mean, we're double the national average in adverse childhood experiences. That's not okay. And when we know that, then it is our responsibility to try to figure out what's happening. So with that, Ramona, she 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 looked at the numbers and based on that information thought we probably needed about 300 mentors.
Really?
Yeah. So
Whoa.
and when we started, we were happy to get 1 or 2, right? And then when we have the new executive director who's there now, the goal was if we could just get 50 or 25. It was
25.
if we could just get 25 in a year, we would be pretty happy.
Yeah.
So we have tripled that number basically
Mhm.
it's been 4 years maybe
Oh, really?
that
4 years.
that Team OC's been around is roughly 4 or 5 years maybe, and, so we're still a long way from 300 of
Yeah.
Ramona's first, "This is what we need," but we're getting there. We're getting there, and most mentor-mentee programs struggle. I mean, because it's a commitment. It's
It's a challenge.
it's a challenge, and our mentor-mentee program really does try to look at the whole child. So, we try to look at not just that relationship with the mentor-mentee, but what's going on in the family. How can we support the family? How can we keep growing the family? And that was how it was set up with SICHC in the beginning.
Interesting.
So
Interesting.
it's been quite the blessing.
Mhm. Yeah.
And
Thank
you
you so
were part
much.
of it.
Well, thank you so much. Yes, I have been part of it. And I've been really grateful that I had that privilege and opportunity. And thank you for all that you've done. I know you've been at the center of the activity.
Well, it's what we're supposed to do.
Yep.
So you just get up every day and you do something. And and relationships, right? I mean, that's what this is all about.
That's right.
Is
Yeah.
relationships.
Yeah.
And hopefully positive ones.
Yeah.
So, we'll kind of wind down this episode, but I'm so happy that you were here to share just a little bit about your career and about mentoring and where you're going to be next.
Well, it's been a privilege. Thank you for having me. And look forward to continuing to hear really good things coming out of Paoli and Orange County.
I
Thank
think
you.
so. It's a special place.
Yes,
I
it is.
appreciate you being here.